இல்லைங்களா? சாரி, இருங்க. நான் ஒரு தப்பு பண்ணிட்டேன். ஸ்க்ரீன் ஷேரே பண்ணல, இருங்க. ஒரே நிமிஷம் இருங்க. ம். ஸ்க்ரீன் ஷேர் ஆகுதுங்களா? ஸ்க்ரீன் ஷேர் வருதில்ல ரூபன் இப்போ? இந்த இருங்க. ஆடியோ
Hello, Ramya ma'am. Can you hear me, ma'am?
Yes, ma'am. We are able
Okay,
to hear
okay,
you.
okay. Thank
Yes,
you.
ma'am.
I was just checking. Thank you.
Yes.
A final year MBBS student at Jamia Medical College. My journey.
ஸோ இந்த வீடியோக்கெல்லாம் வருது.
is Dr. K. Sudarshan. I'm 30.
India. My name is N. Lemon Matthew from the Department.
Yes, please. आता राईट नाव बिझी हा मागीर कॉल करून सांगता तुका आता कॉल करून नाका म्हाका
Good evening, Dr. Connie.
Yeah,
This is
hello, good
Deepthi
evening.
speaking.
Yeah, Dipti. Good evening to
Thank you for
you.
joining.
Yeah, I think I'm on time.
Yeah, you are on time, but our kids are not on time. So
I
please
see.
hold on for some time till they
No
join.
issues, absolutely not. I've kept my evening for y'all.
Thank you so much.
I think Saturdays becomes a problem, no? People planning for their weekend nicely.
Yes, in fact, it's a second Saturday, so they are traveling home today or they are at home
How
today.
sad.
So yeah.
The second Saturday is holiday for y'all.
Yes.
Or other Saturdays y'all work whole day.
Yeah, we work whole day.
Okay.
On fourth Saturday also we have holidays, except
I
for
see.
the final MBBS part 2.
My audio video is just right, isn't it?
Yes,
I'm purposely not
absolutely.
using my, headphones and all.
Yeah,
Yeah.
you're quite loud enough. We can
Okay.
hear you
Thanks.
well.
Thanks.
Yeah.
The chair for today is Dr. Lakshmi, no? She's
Yes,
joined
ma'am.
in.
Yes, ma'am. She has joined in.
Okay. Nice.
Shall we start?
Yeah, Dr. Ramya. The
Dr.
dean is
Ansha?
joining.
Yes,
Doctor,
ma'am.
is
Yes,
the
ma'am.
dean joining? Okay.
Ma'am, Dean will join in the last, ma'am.
Yeah, okay.
Yes, ma'am. Amaljit and Ansha, we will start now.
Good evening, everyone. Am I audible?
You're audible, Ansha, but there is some disturbance.
Ma'am, can you hear me now, ma'am?
Yes, we can
Hello,
hear you
ma'am.
better now.
Okay.
Yeah, we can hear you better
Thank you,
now.
ma'am. Thank you. Good evening, everyone.
Ansha, voice is breaking.
Ma'am, am I audible now?
Yes, Ansha.
Okay, ma'am. Good evening, ma'am. As we come to the final day of our International Student Webinar Series, Resilient View, Winning in Academics and Life, we pause to reflect on a powerful journey. Over the past week, we have explored resilience, not just a skill, but a way of thinking, coping, and growing, especially in formative years of students' life. Today's session brings this series to a thoughtful and meaningful close with a topic that is often overlooked yet profoundly impactful. The silent disruptor, how substance abuse affects the young mind. Substance abuse rarely announces itself loudly. Instead, it quietly interferes with emotional health, cognitive development, academic performance, relationships, and long-term life goals. For young adults navigating academic pressures, cultural transitions, and personal identity, especially international students, this topic is both timely and essential. It's my privilege to have us with an eminent speaker who brings immense clinical expertise and academic insight to these subjects. I warmly welcome Dr. Mary C. D'Souza, ma'am, Professor and Head, Department of Psychiatry, Institute of Psychiatry and Human Behavior, Bambolim, Goa. Welcome you, ma'am. I extend our heartfelt welcome to our esteemed Dean, Professor Dr. K. Edelvedan sir, whose visionary leadership and unwavering commitment to academic excellence continue to guide our institution to greater heights. I am also privileged to welcome our Deputy Dean, Professor Dr. Deepthi Shastri ma'am, whose constant encouragement and academic guidance play a vital role in nurturing both students and faculties and in strengthening our international academic engagements. A special welcome to our medical superintendent, Professor Dr. S.R. Rangabhashyam sir, and also to our Director, Hospital Development Committee, Dr. E.M.J. Karthikeyan sir. It's my immense pleasure to welcome the chairperson of today's session, Professor Dr. B. Lakshmidurai ma'am, Professor and Head, Department of Psychiatry, VMKVMCH, Salem. I also welcome our faculty advisor, Dr. Ramya ma'am, panelist Dr. Gauri Shankar sir, and student manager Dr. Shantaruban sir, and all other participants for today's session. Ma'am, Dr. Lakshmidurai ma'am, we welcome you to take the floor and give a formal introduction about our today's honored speaker. Thank you all.
Dr. Lakshmi, you're muted.
Am I audible now, ma'am? Hello.
Yes, yes.
I warmly welcome our today's eminent speaker, Dr. Mary D'Souza. She's Professor and Head, Department of Psychiatry, Institution of Psychiatry and Human Behavior from Goa. I'm happy on behalf of Vinayaga Mission Kripananda Varya Medical College, Salem, to welcome you, ma'am. And today's topic, the silent disruptor, how substance abuse affects young mind. This is actually the topic of for today's generation, and we see how in higher institutions these problems are there, and how we are facing, and how students are also facing this problem, and how actually without their knowledge they enter into this stream, and without their knowledge their life goes into it. So we need these kind of topic for us to enlighten us, and how not to enter it, how to be cautious, and if at all we enter, how if we see our friends or anybody, so how to identify and bring them back. So I welcome you, ma'am, for this topic, which is the need of the hour. Thank you, ma'am.
So shall I begin?
Yes, ma'am.
Yeah, okay, fine. I will share my screen.
Yes, ma'am.
Just hold on. Okay. Yeah, good evening all. At the outset, I would like to thank the organizers. I would like to thank Dr. Deepthi, who's very well known to me, and she's on to know that she's the Deputy Dean of the college. All the other dignitaries who are present from the college, the chairperson, the organizers. It's lovely to know that the students are themselves the organizers, and that is so very beautifully put, that this thing is for the students, by the students, a very thoroughly democratic way of holding on a webinar like this. And I think this is one way in which we encourage the leadership in our students. And I think this is one thing which will also be useful, because when we talk about drugs and all, the leadership that is taken by the students to prevent drug addictions goes a long way. Well, the topic that is given to me, as you know, is a silent disruptor, how substance abuse is going to affect young minds. And very rightly said, it is a silent beginning, but the way it disrupts the person and the family, and how, in all ways, the substance is going to spoil the life of the student or anybody who uses it, will be like something which we will today learn from this topic. And there are a lot of take-home messages which I'm going to have here. I'm sure the students are going to have a good learning experience from this. So my schema for the presentation will be, I will talk about a few definitions. I will talk about the etiology of addictions, the causes, signs and symptoms, the various substances of abuse. There are, the presentations for these abuses. Then I will talk about how it is associated with criminal behavior, and how our youngsters can go around, protecting their own selves as well as their other colleagues and the student community in general. So coming on to one of the first things which I want to tackle is like, what is a drug? Now, as I know that I'm talking to undergraduates, so I will try to speak in a non-jargon language, which we tend to use for our PGs, and try to be as simple as possible. So when you talk about drug, in medicine also, we will be talking about tablets referred to as drug. So there is something called as a legal drug and an illegal drug. Drug is any substance which will cause physiological changes. So sometimes, when we take medications, there are certain desired changes which we expect, and there are some undesired which we talk about side effects. But when illegal drugs are taken, they will bring about a whole lot of physiological changes, which might be emotional, they might be behavioral, that is, might be certain psychomotor changes which is happening in the person overall. Now, when we take a drug, it can be various routes in which it is taken, whether we talk about a legal drug or an illegal drug. It could be in the form of an oral preparation. It could be a smoking, intranasal injections, and various types. The same thing holds true for illicit drugs of abuse too. A few more terms like, what is drug addiction? Now, drug addiction is a disease of the brain. We have to understand. And that's the reason when we talk about a disease, we talk about cures and how we manage these patients. So it's a disease which is caused to the brain because of abuse of drugs, a long term, most of the times. There are certain drugs which, well, like, if you take even once in your life and then you're hooked onto it, like cocaine or heroin and all. So it leads to various changes in the structure of the brain, and overall it will have a deleterious effect on the life of the individual. There is a minor difference between what is dependence and addiction. I will not go too much detail into it, that because it is more like a PG learning. But let me tell you that dependence refers to the biological effects which occur when a substance is taken for long periods of time. It is a rather a milder form of the drug use or abuse, but addiction is a much more severe form, which refers to a lack of control and the ability to resist urges, and there's a lot of craving which will come on for the substance that is used, and the person will go on using it in spite of a lot of adverse consequences that come into his life. Now, let us come to know why certain people get addicted to substances. And for this, there are various factors. There are biological factors, there are developmental factors, and there are environmental factors which come together in a person. So if you have one, you don't have the others, maybe the person will use a substance, move ahead, and never have addiction in his life. But when all three factors start working together, there are very high chances that this person will be hooked onto a substance for the rest of his life. So the biological factors, the genes are the most important. That person is born with certain amount of genes. Usually, if the parents are consuming a substance, there are 50% chances that the children, the next generation, will also catch on to the drugs. Besides this, the gender. Very often we say males are more prone to substance abuse, but nowadays the trend is again changing, wherein the females also have started using more and more substances. Ethnicity, like from which part of the world you are, there are certain countries which have a very strong prohibitions for substance use, so probably them you may not have, like in the Arab countries, maybe like India is more or less half. You can sometimes see that there is a lot of addictions which will be seen in India. In the US, yes, in the UK, a lot of the substance abuse goes on. So ethnicity holds a lot of importance. In that, religion also is important. There are certain religions which are very permissive to the use of substance. Like, for example, Catholic culture will say, okay, alcohol is kind of permitted in our cultural and religious setting. And then the presence of various mental disorders, like if a person goes through anxiety disorders, depression, major disorders like mood disorders or schizophrenia, now these patients are more prone to substance use, probably alcohol, probably nicotine, which is much more common than the harder substance of abuse. Now, this slide you have to remember, okay, very simply put, why does the person continue using a substance? It is because of the effect of the substance on the brain. Now, the brain actually, what the drug does is it hijacks something called as the reward circuit of our brain. So all drugs of abuse like nicotine, cocaine, they will affect the brain's reward circuit that we call the reward pathways, which is a part of the limbic system. So what happens here? Now, if you talk about addictions, it's not only the substance, maybe even if it is, say, internet addictions, the gaming addiction. Nowadays, people like to scroll and, will have a look at the various reels and you just go on seeing them for hours together. People do gambling. Now, all of this is because they get certain pleasure where the reward system is actually activated. There is a gush of a large amount of dopamine which is released into the system of the person. It gives the person a lot of pleasure. And as the pleasure continues, the person wants to, go on using the substance to maintain that pleasure. So this flood of dopamine is what causes the high or the euphoria. Sometimes when you go shopping also, you purchase a lot of things and you feel very happy about it. So that is the dopamine surge. Okay, so this is the pathway which is almost hijacked by a substance. And as you keep using the substance, you get the pleasure, the circuit just goes on and on. Coming on to the developmental factors. Now, it's not only the genes. What is important is that when the genes, as I said, 50% you give to the genes, 50% is to the other factors. And then in that, we talk about the environmental factors or the developmental factors, which will interfere. There are various stages of a person's life. Like as a child is growing up, like, at the time of adolescence, I think this is the most crucial time when there is a lot of hormonal changes which take place. There is identity crisis, there's a sexual change which is taking place. Now, these are just some very important places in a person's life where the chances of getting a little bit more involved into taking substance and all takes up a primary position. Environmental factors, we talk about different influences, like, what is the background, how, what is the child rearing practices. We say there are over permissive parents who are there, or the parents are usually sometimes absent in the life of like they are all on their own, and the children tend to have a lot of free time, and there's no parental supervision which takes place. Now, these are the children. Besides that, the friends, very important in substance abuse, the peer pressure, okay? Then the economic status of the family, like there is a lot of money which flows in and the children do not have any kind of, hindrance from the parents or guidance from the parents. Usually these children tend to go in for substance abuse. So factors such as peer pressure, physical or sexual abuse, early exposure to drugs, stress in life, lack of parental guidance will greatly influence a person in deciding whether he will be going in for a drug use or not. Now let us see, how does drug have, why does it this drug addiction start on? Number one factor, what we have seen, a lot of evidence base which is there, which says that very often it is the curiosity, you want to know exactly how, what is the feeling that you get, unless and until you experience that, you don't know. So most children, most youngsters or adolescents will want to try it for the first time. So it's the curiosity which is there. So frequent references to drugs by public media many a times. It creates a curiosity for having a personal experience. Friends as pressure. I will be at the end of my presentation showing you a small video wherein, the importance of peer pressure is very important in substance abuse. Many a time mental health problems, the anxieties, frustrations, depression. Nowadays the children have a very short, small frustration tolerance level. So this goes a long way in deciding, you want immediately to come out of all of your problems. You want immediate, happiness. You don't want to experience any pain. And that's how you resort to using substances of abuse. Then in our competitive world, in our MBBS or our other graduate, the studies which are now become so competitive, students tend to take substances to keep awake the whole night because they want to cover up their portions, they have to answer certain exams. Okay, so it is not desirable that it might even lead to mental breakdown. This is one thing which the students have to know. Initially, sounds very simple. As I said, it's a silent disruptor. You may not experience anything very adverse at the very beginning. So they get encouraged to use. So, but many a times it leads to a mental breakdown. Then another thing is that nobody wants to suffer from any pain. So the moment you experience some sort of a pain, maybe it's an emotional pain or a physical pain, the students probably might, want to get relief from their pain. So if, many a times benzodiazepines are the common ones which are given by doctors as per doctor's advice, but patients or the youngsters tend to overuse or continued using of this substance, which will lead to addiction. As I said, also family history. Children may be taking drugs by seeing their parents using the substance in the family. Then we are, as youngsters, we are always curious. We are always looking out for adventure, new things happening. So youngsters want to discover the world on their own. So they will want to try out certain new things. So actually these risk-taking behaviors were very often seen in youngsters. So as I said, to summarize, the causes for addictions could be the peer pressure, the stress that they can experience, the loneliness which is there sometimes. Like many a times, I had this young girl who was doing her PG currently in our institution, Gaur Medical College. She's an all India student. She said, like, I am the kind who do not have much of friends. So one day she decided to, to visit, to go for a party along with all her classmates. And then she decided to use a substance. So all of her friends decided to go in their own vehicles because she didn't have anybody. She was the last one. So she started crying there. So some of her boys from her class decided to help her out. And then they offered her a lift and they decided to drop her at her hostel. But on the way, it seems they molested her. Now, such a thing are quite often seen in our youngsters. Many a times it's a desperate move when you don't understand what is happening in your life. There are a lot of changes which takes place, especially during the adolescence. There are a lot of hormonal things which are happening. So out of desperation, when you know you don't have any support system, you might tend to, go ahead and start trying to use some substance to give you relief. There might be physical abuse or sexual abuse in the younger days in the childhood, probably, which is disturbing the person's mind and making the person use a substance. There are a lot of emotional issues like anxiety or maybe certain phobias or depression, which make the person prone towards using a substance. Sometimes financial crisis may also lead a person to start using a substance. A loss of a loved one, failures in your subject or failure in certain, life situations, curiosity are all some of the causes which can lead person to start using a substance. I have put this small addiction cycle. So how this phenomenon begins? The phenomenon starts off like, the person is experiencing certain, one of these things like stress or pain or desperation. And in that, he starts reaching out. And then he feels the easiest way is to resort to using a drug of abuse. And that will give him a temporary relief, which will lead to certain negative influences or consequences which will take place. And that will lead to again him having a guilt or a shameful feeling. And that itself will again cause a lot of discontent or pain or desperation in a person, and again it will lead to complete the cycle and reaching out to a substance all over again. Now, some of the symptoms that we have seen, generally speaking, for most of the substances abuse, I have put up in this slide. So it might cause a mood swing in a person. Like if the person is now, say, going in a withdrawal, he has used a substance, he feels very happy, good, euphoric, good positive things happen. But after a while, there is a decline of the substance in the blood. So he goes into something called as withdrawal. That is a time a lot of irritation will come in. He will become desperate to use the substance again. So you will repeatedly see mood swings in such a person. Now, continuous use of substance like marijuana and all leads to a lack of energy. There might be other symptoms like a constant runny nose, bloodshot eyes. You've known that in case of alcohol. You might have seen people who are, actively using alcohol. They come out of the bar with lots of these flushed faces, bloodshot eyes. Lot of behavioral changes. The person's habits certainly starts changing over a period of time. There's a lot of loss in interest in certain activities which the person used to enjoy, like he was friends. Now he will say like, no, I don't want to reach out to anybody. He prefers to be all by themselves. Sleeping at abnormal times. Now, most of this substance related, the habit of finding the drug is usually in the evenings when you go out for parties, and also they become the night animals. So daytime they will sleep, and nighttime you will find them awake and doing so many things. Laughing without any reason. Now, these are the later effects of drug, which will come on, the chronic effects. Being away from friends and family, like slowly they will detach themselves from their own people. There are certain signs like spending a lot of time alone, losing interest in his favorite things, becoming nervous, cranky, there is a quick change in mood, sleeping odd hours, having problems at work. Like the teachers will point out that the student was earlier a very studious kind. Now he's all, having a lot of issues with his subject or his academics. Then the eating patterns will change. Sometimes because of the substance use, there might be excess of, eating, or there might be the person might stop eating altogether, and there's loss of weight in certain patients. Coming on to specific substances so that I can give you a fair idea of what happens, I will not go very much into the details. Many times when our patients, especially our youngsters, when they come to us as psychiatrists, they'll say, no, ma'am, I just had a beer sometimes. No, it is nothing. Like they will minimize their habit of using a substance, and especially for alcohol. And they will say like, no, beer is not alcohol. Mind you, the beer itself will have certain percentage of alcohol, which is actually clearly written on the can or on the container from which you are consuming it. So there are like very strong beers, there are very mild beers. So you have to be particular about knowing what is the alcohol content of the spirit that you all are consuming. What are the effects of alcohol on the brain? Surely it will cause brain damage. There will be slurred thinking, unsteadiness, there is slurring of speech. The alcohol does not mix very well. So many a times doctors will always prescribe who are using substance not to mix up taking their medications, prescription drugs with alcohol. So you have to stop alcohol, especially when you're using any other prescription medication. Heavy drinking effects on the body. sometimes may not, it has effects on the bleeding system in the body. So there are chances of having, say, something like esophageal varices, which is a common complication of substance abuse. So bleeding disorders are common if in cases of heavy drinking. Alcohol abuse increases the risk of cancer, and especially for women, and especially during the childbearing age, we will see that, this is one factor which we have to, especially in the Western culture, where alcohol is very permitted. The women have a lot of complications, especially during their pregnancies also, when they are into alcohol addiction. The second substance of abuse, which is very, very common, is nicotine or tobacco addiction. So tobacco addiction can come in very different ways, like smoking or chewing tobacco. So smoking harms nearly each and every organ in our body. And that's the reason why, the TCCs, the tobacco cessation centers, have been opened in most of the colleges by our central government. In fact, even at my college, in Goa Medical College, we in last September 2024, I think we have initiated this tobacco cessation center, where we request each and every department to be actively referring the patients. We even tell the pediatric, department to send their patients. It's not the children that we are looking for. We're looking for the parents who are smokers, because they can cause something called as passive smoking in their loved ones, in their young children, or in their spouses, on the people around them, and that is also equally dangerous. So that when you're smoking, there are other chemicals also which are involved here, like tar, carbon monoxide, nitrosamine, and all the others, which are cancer producing substances. So what are the effects of tobacco? So cigarette smoking can cause lung cancer, painful breathing diseases we call as COPD, and then they will have a lot of effects, oral things which are happening in your, bad breath, bad teeth, bad mouth cancers. So all these things are very important. And in the long run, you have issues with your blood, with your heart, okay, and with your lungs. So all of these are chronic effects of substance abuse, of tobacco use. Coming on to the next substance, and that is cocaine. So you see here how the person is snorting. So one of the most notorious illicit drugs is cocaine. It's like it comes as a white powder, and the moment you use it, it gives a very short burst of energy, euphoria, when it is smoked or injected or snorted. A very short duration. Is one of the most expensive drugs, actually. If you ask me the rate, about 1 gram of this might be about 10,000 odd in the market. So it's like, when these drugs of, why are they calling them illicit? Because there are a lot of impurities which are added to make the drug a little bit more cheaper and affordable to the youngsters. And that is much, much more deleterious for the people who are using the substances. Cocaine highs fade quickly and leave the users craving for another hit. So it's like in case of cocaine, even one snort or a one use can lead to a chronic dependence on this particular substance. Cocaine causes thousands of deaths every year, okay? So most of the time we see that youngsters, cocaine and heroin are one of the harder substances of use, which are very, very difficult to cure also. So what are the risks which are associated with it? Excessive doses of cocaine may lead to convulsions, seizures, stroke, cerebral hemorrhages. Okay, so I have put up a whole lot of things. Okay, there's a lot of psychological dependence which comes on it. There will be a lot of physical deleterious effects which will be there on the person, finally leading to a whole lot of mental health issues like anxiety, depression, and mental health breakdown in the form of mood disorder or schizophrenia. So there are a lot of names which we come. So if you've seen that the person has put lines, they will usually draw up lines and then they will snort it. Okay, so I will tell you a small story, just a small break in the continuous bombardment of this what that I'm doing. There's a story of this young addict, who once had he comes upon a magic lamp, these Aladdin's lamp kind of a thing. He rubs it, and there is a genie who has come to fulfill his wishes. So the genie says, "My master, now I have 3 wishes that I can grant to you." Okay. So the boy says, like, "Okay, you are going to give me then I am going to ask you my first wish. My first wish for the best 4 lines in the world for you and for me." Okay. So the genie now makes the thing available, so they both enjoy the 4 lines. And then the genie says, like, "Okay, what is now your second wish?" So again the drug addict says, like, "Okay, I want another 4 lines for you as well as for me." So they enjoy the second set also. After they finish that, the genie says, "Yeah, my master, now I have to give you your third wish. What is your third wish?" And then again, the drug addict says, "Give me another 4 lines, and you have to take for yourself also." So the both of them enjoy themselves. And at the end of it, the little genie says, "Now, sir, you can tell me what is your fourth wish." So to summarize, the drug addicts have so much of influence that by the end of it, the genie himself has become an addict and forgotten that he had to, grant him only 3 wishes. Okay, so such a thing does happen. Another very common substance of abuse are these cough syrups. Okay, I had actually, I was working in Belgium sometime back in 2004, where I had this young medical student who was used to using codeine syrup. Codeine is a cough syrup which used to come, and I think it is now gone off the shelf because youngsters started using it like a substance of abuse. So he used to use around 25-50 bottles a day. And then when I came back and started my work in Goa Medical College, and I usually reflected and tried to reach out to some of my friends in Belgaum, I realized that that boy had overdosed and ended his life because of this substance. So such deleterious things do happen with substances, and we have to be extra cautious. So the active ingredient in this cough syrup is the dextromethorphan, which is a derivative, which is a synthetic derivative of opioid. So more than 4% of school children are known to be using cough syrup as a addiction. So it goes in various names. I'm not going to read all of them. I just put them, so that you all also understand when people talk about it, you should also know what are they referring to. Okay. So there are these kind of, cough syrups which are available. And the next substance of abuse which I can discuss here is goes by the name of ecstasy. Now, ecstasy is again a common one, especially in places like Goa. It's a go-to club drug for youngsters. Again, this is a formulation which comes in a very crude format, because when it is in a pure form, it is very expensive. So ecstasy means it is MDMA, which is often mixed with various ingredients to give a kind of a rush of dopamine, and that is what is the more addictive part, and that is also the one which will cause a lot of overdosing which happens because of drugs, is because of the mixtures which are happening. Okay, so what happens? There are a lot of street names which I have mentioned here. So why is it called a love drug? Because many a times it brings people together, youngsters together. So it's a go-to the club, youngsters club. They tend to get together and tend to use this kind of party drugs. They tend to relate to each other. They have a good trip and all that kind of a thing. So that is why it's called as hug drug or love drug also. The risk associated with it can cause severe damage to almost all of the organs in the body, especially the liver, the kidneys. It can cause CNS damage. And the long-term use can cause serious effects in your brain, resulting in depression, memory loss. Okay, overdoses, I don't have to tell, it can lead to fatalities, which are very, very often seen because of these drugs. Another notorious substance of abuse is heroin. Again, it goes, with different names. I will be mentioning that in my next slide. And this is the second most commonest drug of abuse. You might have heard about, the crude form of it in the name of brown sugar and all. So here it is all adulterated and mixed up and given. So many a times patients take it orally, they snort it, or they might use it in the injectable form. Okay, the final result is just to derive some sort of a pleasure or euphoria, which will last for a few hours, and then again it will go to a very unpleasant feeling. So there are various names by which it goes in the on the streets. Coming on to the effects, the risk that is associated with, it leads to weight loss, malnutrition, because people tend to ignore their nutrition, their diets. It causes sedation, chronic apathy in a person. Abrupt stopping of this substance can lead to something called as cold turkey. What is cold turkey? It leads to the piloerection. There is severe pain in the stomach. The patient may get tremors, panic, runny nose, chills. Okay, and sweats, cold sweat is there. It's a very, very unpleasant thing. And this is the time when usually we will get these patients coming to hospital for addictions for the relief of these symptoms. So users have always got this risk of overdosing, and there's so many celebrities that if you just scan, you go to Google through, you will come across people like Michael Jackson, Whitney Houston. These have overdosed on these substances and ended their lives. Then there are these inhalants. What are these inhalants? The inhalants are like when, especially when you go to petrol pump, you just whiff that, kerosene, the diesel and all that, you feel very nice. Now imagine the street children, all the time inhaling these oils, these glues and these, tars and all. So these are gases or household cleaners or markers or random objects which are in noxious fumes. So they will take it, on a cloth or something and hold it towards their nose and go on inhaling. So when a teen uses an inhalant, they will often have the empty contents into a rug or a plastic bag for long periods, and they will go on. So you will find a lot of exfoliation which is taken around their noses. There are some sort of infection around their nose and their mouth. Inhalants, the chronic use can lead to serious damage to the brain. The regular use leads to damage to their heart and other major health problems. So again, here they're known by a lot of different street names. Okay, so you have to know them because, whenever you share something, when people talk to you and you want to really help them out, these are the words which will help you to understand and identify that they are referring to, some of these substances of abuse. Coming on to the next substance of abuse, and that is LSD. Again, it is an infamous psychedelic drug, which is very popular in the olden days, but it is still available as a small paper, square paper, which they will, put on their mouth, and they will suck on it and they will experience, so many a times LSD may be experienced with a good trip. They talk about a good trip or a bad trip. Good trip means it's an enjoyable experience, or it might be a bad trip. So there are various names which are by which it is going, on the street. Let's not go too much into the details. I'll just put it for 1 minute there. And there are various other hallucinogens. LSD is a hallucinogen, mescaline, or, they are often referred to as mushrooms, the psilocybin. Okay, all of these will increase the glutamate increase in the brain. Again, that will be the high, the dopamine high, which is coming in. And there's a lot of hallucinations in different systems that the person. So we often call them as the synesthetic. Like they can, you don't see colors, you can hear colors. So in different modalities of the sensory system that they will. So that is called as the altered sensory perception, shape and color distortion, which will be there. Flashbacks. There are certain trips. There might be good trips or bad trips, which will be there. So there are a lot of somatic symptoms like nausea, blurred vision, which will be seen by them. Now, the commonest plant of abuse, which is very frequently seen, especially in our Indian setting, is the marijuana or the weed, which is again a illicit substance. Some countries have called it the illicit, the legal drug of use and all that kind of a thing. But in India, as yet, we are not yet into this. It causes paranoia and impaired motor function. Again, it is very, very addictive. Very often, alcohol, nicotine, marijuana, we say other initial drugs or the gateway drugs. Because once the effect of this wears off, and they are not much of use, the youngsters tend to use the harder substances of abuse like the opioids, the cocaine and LSD and all the others. Okay. So this is how the plant looks, and these are some of the names. You must have used ganja or bhang during the Holi festival. It's supposed to be ritually, in our culture, because it's supposed to be some sort of a bearing on Lord Shiva and things like that. So our sadhus and all, if you see at the base of the Himalayas, they are found in this sort of a position which they acquire for long hours. Even you can see they have these mud molehills all over them. They can sit for days and months and years together. So what we refer to here is probably something called as the schizophrenia or the amotivational syndrome, which is a chronic effect of marijuana use. Now, let us see some of the issues which are there when a person starts using substance, and over a period of time, how the criminal behavior, what is the connection between drug and criminal behavior? So criminal offenses are related not only to possession of drugs or usage of drugs, possession or selling of drugs. We talk about the peddlers. So if they are caught, and then they can be, tried in courts, and there is a lot of punishment in terms of fines and even imprisonment. Criminal offenses may be directly related to the individual effort in buying the substance. Like, when they don't have money, what they will do, they will start stealing, burglary. They break into shops and steal things, and try to substantiate for their habit by such measures. Criminal offenses related to aggression and violence. Many a times when they start using the substance, they end up fighting with each other. Murders can take place, which is very, very often a sequence, or there might be sexual assault, and like how I was referring to that earlier case of the student, the husbands beating up their wives after consuming alcohol or other substances of abuse. This is another criminal behavior for which they can be taken into further legal action. Criminal offense is also related to association with other offenders. And especially when you're dealing with these peddlers and all. Criminal offenses related to driving under influence of substance is also very important. It has its own consequences. So we have this NDPS Act, and according to that, a person who is using as well as who's peddling will have various types of punishments, which might be in terms of finances or paying fine, or it could be in terms of imprisonment. So these are a couple of slides which it might be extending even up to 2 lakh of rupees for having a particular amount of substance on you when you are caught by the police. So these things are very, very common, things which will come in terms of law. Now, what are the ways in which you will try to cope with it? Like, whenever you are experiencing peer pressure, okay, what are you supposed to be doing? So what is the self-protective mechanism that you can build? So if you are offered drugs and you need to be very, very emphatically saying no to it in the affirmative. And for that, the knowledge is very important. And I think this is one initiative which your college also has taken, wherein they have called in an expert to talk about the substance and all of the deleterious effects that it has on your body and on your life and on your family also. Okay, so if anybody tries to persuade you can even use humor, which is a very effective way to deal with the situation. Having the strength to say no can be very hard, but each of you have to develop this, because there is no two ways about it. So if you are forewarned, you're knowing what is happening, and you know that this is going to be a drug which is going to spoil your future, and there's no two ways about it. You have to say a no. So it is important that you stick to it and say, no, I will not be joining you. Explaining to the people in a calm way why you don't want to be a part of something may earn you respect from the others for that matter. So finding out about the different drugs, what are the effects, you yourself can change those people and bring them into a no drug zone, correct? Then, if you see somebody else using a substance, would you keep quiet? No, try to help them. What is important here is that we need to talk to each other. If you have a friend who's now suddenly, you're finding all of those signs and symptoms that I have just described, there's a slow change in the personality of this person. Earlier, how he was, and now he's keeping himself withdrawn, his grades are falling, and you find that he's become more and more cranky. You look at the person's body language and you will understand that Baba, something is there. So you try to please help that person. Okay, talk to that person. Look out for all of these symptoms, what are there. Okay, so what are these emotional and social symptoms that I'm again trying to, revise that by mentioning that if you see that some of your friends are into it already, what do? You go and reach out to them, see in what way you can help, because as age mates, they will relate much better. They will be able to listen to you. And if you have said no, an emphatic no, they will learn something from you also. And they will say like, okay, I need to listen to you. So sometimes the elders speaking may not work the best, but you as your colleague, as a colleague speaking to them may, go a long way in helping out this person. So what are the protective factors? Mind you, if you think you need to reach out, please reach out to their family. Please reach out to the counselors. Now, every college, every school has got a school or a college counselor. So you have to refer these people to the counselor to find out what is the reason. Why is this that the person is changing? The behavior has changed. Why are these subtle things which are seen in this person? Okay, so when you reach out to these people through the support system, maybe their families, community support, improvement of their schooling system, education. Now, I feel this is very important that the college takes an initiative. There are various ways in which you can do, like the life skill activities, learning to use judgment, coping with your peer pressure, learning to say no to drugs, steps needed to ensure a person does not fall in a drug trap, the steps leading to a commitment to using drugs. All of this you tend to know when you read more, when you understand what is happening around this drug scenario. So let us see what are the practical things, like, yeah, as youngsters, as college going students, you can do. You will have to share what knowledge you have in your neighborhood. Okay, you in your community, and then the world at large. That we always, every year, India celebrates, so the world celebrates the International Day Against Drug Abuse. Participate in that. So that is a day why we are having that day. We give excessive importance, on this aspect, that you have to say no to drugs. And there are a lot of awareness activities which are conducted. And the day which is, do you know the date? It's 26th of June, which is considered as the International Day Against Drug Abuse. Okay. So what are the things which you can do? You can organize art contests for children, college going students. We have these time and again. I'll be sharing with you one video which is prepared by students like you only, which is passing on a wonderful message for the youngsters. Okay. So without further ado, another thing is sports. Take up sports, which is a wonderful activity. When you're physically drained, you have this physical high, lot of dopamine release. You don't have to resort to anything artificial to bring on pleasure in your life. Designing t-shirts, slogans, saying no to drugs, collecting money for charities to help street children, sharing their knowledge with interactive games and everything will go a long way in helping curb this nuisance. There is an active helpline which is there. If you need for yourself, for your friends, please resort to this number. There are counselors who are available who will help the victims of drug abuse. And then we come across this lovely video. As I told you, this is done by the students, and there's a beautiful message which goes. So kindly listen to it.
रोहित, डॉक्टर कुछ पूछ रहे हैं तुमसे, जवाब दो। रोहित, क्या तुम स्मोकिंग करते हो? और कब से करते हो?
Is it audible? Anybody can tell me?
It is audible.
Yeah, thank you.
यहाँ पे क्यों लेके आए? ये भी अपने ग्रुप में शामिल होना चाहता है। अच्छा, स्वागत है, लेकिन तुझे एंट्रेंस टेस्ट देना पड़ेगा।
मतलब क्या करना पड़ेगा?
वेपिंग,
ये क्या होता है?
जो हम अभी कर रहे थे।
मतलब स्मोकिंग?
स्मोकिंग नहीं पागल,
वेपिंग, वेपिंग।
ये किसे उठा के लेके आए? इसे वेपिंग पता नहीं है। जा भाई, तू ना किसी भजन कीर्तन का ग्रुप ज्वाइन कर।
इतना क्या सोच रहा है भाई? और किस जमाने में जी रह रहे थे? आजकल अपने से छोटे बच्चे भी वेप करते हैं। अगर ऐसे ही रहा ना तो तू डाउन मार्केट ही कहलाएगा। बोल रहा हूं मैं, सोच ले। ईशा, मुझे तेरा जर्नल चाहिए था। जरूर देती अगर तू हमारे ग्रुप में होता, लेकिन तुम्हारे ग्रुप में शामिल होने के लिए
वेपिंग करना पड़ेगा। बस वेपिंग। मैं लड़की होकर वेप करती हूँ, सोच ले।
तो क्या फैसला हुआ तेरा?
यार मैंने गूगल पे सर्च किया, वेपिंग सेहत के लिए हानिकारक बता रहे हैं।
अरे इससे कुछ नहीं होता, इससे सिर्फ मजा आता है, ओनली फन। और वैसे भी एक ही तो जिंदगी है, मस्ती से जी ले। अगर ऐसा ही रहेगा ना तो आउटकास्ट हो जाएगा, सोच ले।
या मैं तैयार हूँ,
ये हुई ना बात।
लेकिन इससे
लेकिन छोड़, ये ले और ट्राई कर। मेरे चल ले। अरे ये वेपिंग है ना, जेंजी थिंग है, जेंजी। तू तू ना बिंदास ले ले इसे। इसके अलग अलग फ्लेवर्स है, ब्लूबेरी, बबल गम, मिंट और भी बहुत कुछ। हर एक फ्लेवर ट्राई कर ले।
ये ना सिर्फ पेन की तरह दिखता है, बाकी ना किसी को कुछ नहीं पता चलता रे।
अरे सुनो, मेरे वॉलेट से पैसे गायब हुए और परसों भी हुए थे। भाई तू वेपर हो गया अभी? सच में, हमसे भी बढ़िया वेपर हो गया तू। सही है भाई।
रोहित, पिछले कुछ दिनों से देख रही हूँ तुम ठीक से खाना नहीं खा रहे हो।
कल रात भी खांस रहे थे, डॉक्टर के पास चले जाना।
इन्होंने परसों ही तुम्हें डॉक्टर के पास जाने के लिए कहा था। अरे, इसे तो सांस लेने में दिक्कत हो रही है।
चलो अभी डॉक्टर के पास चलते हैं।
रोहित, मैं फिर से पूछता हूँ, क्या तुम स्मोकिंग करते हो?
मैं वेपिंग करता हूँ।
वेपिंग?
यानी ई सिगरेट, स्मोकिंग का नया वर्जन।
लेकिन ये सेफ है, इसमें तंबाकू नहीं होती।
किसने कहा?
मेरे दोस्तों ने।
इस गलत फहमी में मत रहो। इसमें निकोटीन होता है जो तुम्हारी फेफड़ों को हानि पहुंचाता है। वेपिंग ये एडिक्शन यानी एक तरह का नशा होता है और बीमारी।
लेकिन मेरे दोस्तों को तो कुछ नहीं हुआ।
लेकिन तुमने तो अनुभव किया है, सांस लेने में तकलीफ रहती है, बात हार्ट अटैक या कैंसर तक भी पहुंच सकती है। ये तुम्हारी सेक्स लाइफ पर असर डाल सकता है। अच्छा हुआ तुम सही वक्त मेरे पास आ गए, वरना। ठीक है, मैं तुम्हारी मदद करूंगा, तुम्हें दवाइयां दूंगा, लेकिन असली लड़ाई तुम्हें लड़नी होगी। वेपिंग छोड़ना होगा।
मगर वेपिंग छोड़ूंगा तो डाउन मार्केट कहलाऊंगा।
इसी सोच को बदलना होगा रोहित। नशे से किसी का मार्केट अप और डाउन नहीं होता है। और तुम्हारी जनरेशन तो हेल्थ के बारे में कितनी कॉशियस है। अच्छे स्टार्स, अच्छे खिलाड़ी कितना ख्याल रखते हैं अपनी सेहत का।
डॉक्टर, ये वेब या कुछ है, ये खुलेआम मिलता है क्या?
नहीं, भारत में इस पर पाबंदी है। अगर पकड़े गए तो जेल भी हो सकती है। ये कहाँ इन चक्करों में आ गए? जल्दी निकलना होगा। निकलोगे ना?
हाँ, और अपने दोस्तों को भी निकालने की पूरी कोशिश करूंगा।
So with that, I come to the end. Thanks for patient listening. Any questions? I'm open to them.
Thank you, ma'am. Thank you for the inspiring talk. This session clearly brought out the hidden dangers and long impact of substance abuse on youth, leaving us more aware and responsible. Thank you for your valuable time and insights. With utmost respect, I request Dr. Lakshmi Dharai ma'am to commence the question and answer session and guide the interaction ahead. All the participants are warmly invited to drop their queries in the chat box. We will address them sequentially and request our teams to insights on the points raised. Over to you, ma'am.
Yes, ma'am. Dr. Mary D'Souza, ma'am, that was really a thought-provoking talk on substance abuse among young people. Apart from being an academician for past 24 years and you're as an author for several national and international journals, ma'am, your experience as national trainer on mental, neurological, and substance use disorders module on Ayushman Bharat and your clarity in delivering such complex interplay of biological, psychological, and social factors are very appreciable, ma'am. Your explanation on social factors, especially after the abuse, substance addiction and its legal consequences, are also very much very interesting, and your guidance on how to approach, because that is also very important. Like how you guided them, where to seek help, and your it was really informative. And I'm confident that through your interesting slides and your short film also, our students are motivated and they understood very well on the topics like the depth, how you explained. We all are motivated, ma'am. Thank you. Hope this guides them. And open to the audience. Any doubts or anything you can ask freely. Students? Any questions? Any questions?
Dr. Lakshmi, there are two questions on the Q&A section.
Okay. Yes, ma'am. Ma'am, there is a question asked by a student. Ma'am, I will just read, ma'am. Substance abuse by a pregnant woman is more hazardous for fetus either during gestation period or lactating period, ma'am.
It is during both the conditions. For that matter, we know that even medications, when they are taken during pregnancy, we take extra caution. I'm talking about legit medications. Okay, so substances of abuse, especially alcohol, definitely no, because it leads to something called as a fetal alcohol syndrome. Even in the child, the mother can have a lot of problems like abortions, stillbirths, and things like that. So yes, any substance of use or abuse needs to be definitely dealt with a lot of caution. Illegal drugs, definitely no. Even medications, we have to be that cautious.
Okay, correct. Ma'am, second question. I would like to ask, good evening, ma'am. I would like to ask a query. Is addiction an illusion of a disease in the brain or a failure of self-control or both?
Yeah, I think I have explained that in my slide 2 or 3, wherein I'm talking about it is a disease. Okay, so there is no two ways about that. And we know that now the pathway which is affected, that is the limbic system. And in the limbic system, we have something called as a reward pathway, which is hijacked by the drugs. And because of which the person, it's not that every person who uses a substance will end up being an addict. Please understand that a person who takes alcohol, that otherwise our whole society would have been full of alcoholics, right? So it's only a few people when all factors, I was talking about 3 different types of factors: biological factors, developmental factors, environmental factors. They all interacting together will be bringing about the whole set of addiction. So it's not one factor, correct? So basically, yes, it is a disease and needs to be taken under treatment.
Thank you, ma'am. And the third question is, ma'am, how can we handle drug addict patients?
So for drug addict patients, when they are in the state of withdrawal, that is the time when they may come to a doctor. If you look in Goa, no, I will tell you the scenario. If you look in our wards, you may find some alcohol addicts, but you will never find the harder substance of abuse. The day we read that a Nigerian is caught with, so much of heroin or cocaine and all, the very next day I'll have a set of addicts admitted in our hospital. What is the reason? The moment there is a cutoff in the supply of the drug, the person goes into withdrawal. That is the time when he will go through certain unpleasant experiences, physical withdrawal, psychological withdrawal, and may approach a doctor for treatment. So once he comes into treatment, most of the drugs have symptomatic way of management. Okay, so there are certain ways, like, when it's a heroin addict and all, and they are going through a lot of physical pain. As I told you, there are a lot of muscle pain, stomach, spasms will be there. For those, we try to give them supportive care, some muscle relaxants probably to deal with that. Then we have what is known as detoxification and de-addiction. 2 phases which are there, which will conclude the whole treatment. So it's usually a long-term treatment that we are looking for. Sometimes we have to keep for de-addiction for long periods of time. So we call them as rehabilitation of a patient. So there are certain de-addiction centers where the person is kept. What is the reason? Here you are in a very protected environment. So the supply of drug is cut off and the doctor will treat you. So the initial treatment is referred to as detoxification. That is, whatever drug is there in the body is removed. And then when he starts craving and he wants to go in for the rehabilitation, you need motivation for that. The person should say, like, I want to say, no, I don't want to take drugs any further. So we have to build up that motivation. And then we start something called as the second phase of the treatment, that is the de-addiction, wherein there are certain medications which are available for craving and on the psychological dependence part of it. And we go with a lot of, like, alcohol, we'll have the Alcoholic Anonymous Club and all those other, social community care, which is going to be a part of the treatment. Okay. So basically, it's a long-term treatment. Correct. And most important is that the addict has to be willing for the treatment. The motivation has to be there for this person to give up the substance.
As you rightly said, the motivation is very important. Unless until they realize that they have to stop, even after de-addiction, the detoxification phase, it is very easily they go for consuming the substance. And all. So that protective environment also plays a role, and the motivation also plays a role. Yes. There is another question by the same student, Anika. She said she thanks you for your explanation.
Thank you so much. My pleasure.
Thank you, ma'am. Thank you for offering such clear, meaningful, and deeply enriching responses. Now I welcome our respected Dean Sir, Professor Dr. K. Edelvendan Sir, to share a few words regarding this. Welcome you, sir.
Ma'am, good evening. Dr. Mary D'Souza, ma'am. I seen you joined in 2 or 3 webinars. That seems first webinar I seen you. You joined in.
I joined in. Yeah.
Yes, ma'am. Thank you so much. So wonderful things. It is a need of it's very much is needed for the students because they should understand like what kind of things. It's all over the world. It's right now. It's going in this kind of turmoil. At the same, you conveyed them crystal clear questionnaires and answers, and it's a beautiful talk, ma'am. From Goa, I think the ma'am's, Deepthi ma'am's, the connections is Goa connections. I feel always very proud that, to your and wonderful team from the Goa. Thank you so much, ma'am. On behalf of Vinaya Mission Research Foundations and Vinaya Mission Kirbandavariyar Medical College, once again with the Students' Council, thank you so much for your time and your all these inputs for the students.
It's my pleasure,
Uh,
sir.
Yes, ma'am. So we will invite you in person, ma'am. We will invite you in person next year. I'll work it out with the Dr. Deepthi, ma'am. As whenever you're free, we can call through this Department of Psychiatry for the CME. And it's also we plan to just having a conduct. We are planning to just have a women's empowerment. The 2 days workshop for the international workshop. Once our auditorium is renovation is going on, once gets ready, so we'll have a good plan. It's a wonderful conference that might be international one. For that, I will invite you, ma'am. Please do come. Don't say no if times
Thank
and
you.
all things
Of
permit.
course.
Please do welcome, ma'am.
I will
Thank
try
you.
my best, sir.
Thank
Yeah.
you. Thank you.
Thank you.
And behalf of Students Council, I have to thank all the participants from Vinaya Missions and all over the world, all over the India, particularly. Few people has joined other countries also, and
Thanks, sir.
I want to congratulate the entire students. Madam, I have decided two competitions, which Deepthi ma'am and Dr. Ramya will explain you. For the students, behalf of Students Council, I just given a prize money of 5,000, 3,000, 2,000 for the one competition. The next one is also the same. And is also in this forum again, one more time, I reiterate like what I have conveyed in the first webinar. Next time, the Students' Council, Vinaya Mission Research Foundations, I'll promise you, Students' Council oration, you can choose any student from the India or international student who is doing is the greatest in the public service, maybe is in a community-oriented programs or is a star of that any topics. Our committee will choose a persons. You can give a 3 persons. Our committee members will choose a one with the Students' Council members. And for that oration, we will give us a 50,000 rupees as a cash prize award for that students. The only thing is that he must be a student, either is UG or PG, a standing orations. All the committee members will say. But that is also, madam, Dr. Behalf of myself and Dr. Deepthi ma'am and our we will invite you, Dr. Mary D'Souza, as one for part of member of this committee to choose a persons. This is a we very honored to just have you in our committee,
It's a
ma'am.
great initiative, sir. Of course, I will love to support it, sir. Yeah, sure.
Absolutely, ma'am. Yes, ma'am. Deepthi ma'am, you can carry out, ma'am. Please, ma'am.
Thank you so much, sir. Dr. Ramya?
Yes, ma'am.
Thank you, sir. Thank you for your heartfelt words. Now I request our Dean Sir, Professor Dr. Elvendran Sir, to honor our speaker, Professor Dr. Mary D'Souza, ma'am.
Thanks a lot, ma'am. This is e-certificate and original certificate we will courier to you, ma'am.
Thank you so much.
You can display it.
Honor.
Thank you, sir.
You can
Now I
display that.
request you to please honor the moderator of today's session, Professor Dr. B. Lakshmi Dorai, ma'am.
Dr. Lakshmi, thank you so much, ma. I think we are blessed to have a Madam Dr. Mary D'Souza in this topic. You moderate the session is so well as usual. Thank you so much, Dr. Lakshmi. Dr.
Thank you,
Ramya,
sir.
you can coordinate with the Deepthi ma'am and announce that winners and all of them.
Yes, sir.
Yeah.
Sir Vishal, Dr. Vishal, the President of Student Council, is announcing the winners list, sir.
Thank you, sir. Now I would like to welcome Dr. Vishal, President Student Council, to announce the winners of selfie contest and success story contest. I also welcome our Dean Sir to congratulate the winners.
Yes, Amaljeet, I have conveyed already. This is a great competition and a great motivation from Students' Council. This is the first kind of webinar. So students themselves took it in the front and led the team of entire faculties. They led all of us. Thank you so much, Students' Council members, all of you, wonderful student things. And I'm expecting the more from you from the next time.
A very good evening to one and all present here. I am Dr. Vishal Tulasimani, and I am feeling immense pleasure in announcing the prize winners for the Success Story contest. The third prize goes to Dr. Lemuel Matthew. The second prize goes to Dr. K. Sudarshan. And the first prize goes to Dr. B.V. Aditya. I repeat, the third place
Congratulations. Congratulations to all of them.
third place goes to Dr. Lemuel Matthew. Second place goes to Dr. K. Sudarshan. And the first prize goes to Dr. B.V. Aditya. Next, we'll proceed with the selfie contest. There are three contests. Two prizes. The third place in selfie contest goes to Dr. S. Prithvi from Vinayaga Mission Kripananda Warrior Medical College and Hospital, Salem. Sir is a postgraduate. And third place is also shared by Nishita Dominic, Father Muller Medical College, who's an undergraduate. The second place goes to Jia Panjwani from MGM Nerul, who's an undergraduate. And the first place for selfie contest goes to Raj Shrimala K from Vinayaga Mission Kripananda Warrior Medical College and Hospital, Salem, who is a postgraduate. I warmly wish all the winners and the participants of both Success Story Contest and Selfie Contest a very big thank you. Thank you. Over to you, Amarjit.
Thank you, sir. Now I request Dr. Sara Mike to propose the vote of thanks.
Following the vote of thanks, we will display the selfie and success story contest videos.
Good evening, one and all present. I'm Dr. Sara Preeti. As we come to the conclusion of the International Students Webinar Series, it is my privilege and honor on behalf of the Students' Council of Vinayaga Mission Kripananda Warrior Medical College and Hospitals to propose the vote of thanks. First and foremost, we express our heartfelt gratitude to our esteemed speaker, Dr. Mary D'Souza, for delivering a highly insightful and thought-provoking talk on the silent disruptor, how substance abuse affects the young mind. Your lucid explanation and deep understanding of this crucial yet often overlooked issue have left a lasting impact on all of us and have greatly sensitized our students to the psychological, social, and medical consequences of substance abuse. We sincerely thank our respective moderator for expertly guiding the session and ensuring meaningful interaction and smooth flow of discussion. Our deepest gratitude to our respected Dean, Dr. L.L. Venan sir, for his constant encouragement, visionary leadership, and unwavering support, without which this International Students Webinar Series would not have been possible. We also extend our sincere thanks to our Deputy Dean Ma'am, Professor Dr. Deepthi Shastri Ma'am, for her valuable guidance and continued support throughout the series. We respectfully thank our Medical Superintendent Sir, Professor Dr. Rangabhashyam, and Director on Hospital Development Committee Member, Professor Dr. E.M.J. Karthikeyan Sir, for their encouragement and institutional backing. We are extremely grateful to our faculty advisor, Dr. Ramya, Professor, Department of Pharmacology, for her continuous mentorship, motivation, and guidance to the Students' Council at every step. Our sincere appreciation to our esteemed panelists, Dr. Gauri Shankar Sir, Professor, Department of Pathology, and Dr. Shantaruban Sir, Student Manager, for their expert insights, valuable perspectives, and engaging contributions which enrich the academic quality of this webinar. A special word of thanks to our technical team, to our PR team, to our IT team, and all the members of the organizing committee who dedicate efforts behind the scenes and the seamless conduct of this entire webinar series. We also thank all the participants for their active participation, thoughtful questions, and enthusiastic involvement, which truly made this and the entire series full and successful. Conclusion, I extend my sincere thanks to everyone contributed directly or indirectly to the success of the International Students Webinar Series. Thank you all for your presence, support, and cooperation. Have a pleasant evening ahead. Thank you.
Namaste, I'm BV Aditya, a final year MBBS student at Jamia Medical College. My journey didn't start with confidence, it started with doubt. I wasn't the topper of my class. I wasn't the most impressive person in my room. People always criticized me for the way I looked. People laughed at me. People ignored me. Honestly, it hurt. But in my mind, I always used to say, one day they'll listen to me. That one day came when I was roaming during my clinical postings. I came across a person with diabetic foot ulcer. He asked me, "Doctor, will I lose my leg?" That moment shook me. I then realized medicine isn't about treating diseases, it's about restoring hope. So, I wanted to build a solution for this. I teamed up with my engineering friends from computer science department and built a smartphone app known as Heal AI, which is a AI-powered platform for monitoring diabetic foot ulcers using just smartphone images. Initially, we heard a lot of no's than yes. People said it was too unrealistic, it was over-ambitious, and it was too early for undergraduates, but we never stopped. That persistence took us to the National Bio Entrepreneurship Competition 2025, wherein out of 4,000 plus startups, we came top 6 in India. And we also won rupees 2 lakhs from Dr. Kiran Mazumdar-Shaw herself. From being underestimated to standing on one of the biggest innovation stages in India, that was my turning point. My research journey was also growing too. My article got published in the Artificial Intelligence in Health Journal, and never mind, I also won the Best Student Researcher Award in my college. From criticism to confidence, from being underestimated to being recognized, this is my comeback story. Thank you.
My name is Dr. K. Sudarshan. I'm 32 years old, and today I stand as a soon-to-be MD radiologist. I was born into a simple, middle-class family. Both my parents were physical education teachers, but they were also my first gurus. They taught me discipline, commitment, and humility. Since childhood, I was an all-rounder. I painted, I danced, and I acted. I played sports at the highest level: national level badminton, netball, and handball player, state level basketball player, and divisional level shot put and discus thrower. I always had two dreams: to become a doctor and to become an actor. After school, I told my uncle just one thing: either I'll do MBBS or nothing at all. Through sports quota, I got medical seat. In my final year, despite working hard, I had a downfall, my first failure ever, and it broke me completely. I isolated myself. I fell into depression. But my friends stood beside me, and I rose again, stronger than before. After MBBS, I started working and preparing for NEET PG. But problems came one after the other. No money, no guidance, no support. I went to Delhi for coaching, and on the third day, lockdown was announced. I fought COVID 4 times, lost memory and strength, but not my spirit. I kept writing NEET again and again. Sometimes my system froze during exam. Sometimes life froze outside the exam hall. I almost quit many times, but my family said only one thing: whatever happens, never give up. We are with you. Today, because of their sacrifice, I'm here, a soon-to-be MD radiologist. My success is not mine alone. It belongs to my parents, my uncle, my aunt, and my sister, especially few friends who stood beside me. I had depression, spinal disc prolapse, financial struggle, failure after failure, but I never gave up. This is not just end of my story. This is just the beginning. I am Dr. K. Sudarshan, doctor by profession, artist by passion, and I promise the world will hear my story again, but next time on a much bigger stage. Thank you so much.
So, good morning, one and all present here. My name is N. Level Matthew from the Department of MSc Cardiac Catheterization and Intervention Technology, School of Allied Sciences, Salem. So, today I want to share a painful story, but at the end, it is a victory. So, in 2019, I met an accident and I got shattered my both legs, and I am still having a rod in my both legs. And you can see my right hand having a rod. My left hand is only survived in that. So it is a terrible accident, and everyone told, doctors also told he can't walk in around 6 months, for around 6 months. But I stand in just a month and started walking and started running. And that moment I felt like something happening in my life and changed everything. But when I started joining the UG, my legs started to feel pain, that much of pain, something walking in a fire. Every step, still now, I'm feeling the pain that I can't walk. Everyone started to bully me because of my walking style, because I can't walk properly. My legs will be like, my right leg is too big, my left leg was something small of 2 inches, so it will be like this. So everyone started to bully me. If I go somewhere, means I walking, means a group of people will see my face, and then they started to see my leg and they will say something to themselves and they start to laugh. I will literally cry at that moment at the road itself, down like this. I will start to cry, God, why this? If you want like this, means you can take my life itself. Why this kind of things? At that, I saw a man in front of me at the time itself. He has no legs and no sight. A voice just whispered in my ears saying, what is your reason? Now tell me, what is your reason? You having legs, but see that man, but still he is walking. So at that moment I decided to join Masters, and I joined Masters. Now I completed 5 book chapters, and I completed an entire book in cardiology related to my department, and I have 20 national and international awards in South Indian conferences. And where I have bullied in my UG, now I got nominated as the Best Alumni Award of 2025. So what I want to say is, nobody can predict the future, but you can make a future. As I want to end this my victory story in a Tirukural, as it says in my mother tongue, தூரத்து பார்த்து துளைவில் நின்று உற்றுக்கண் ஊறுத்தும் காட்டும் அறிவு. The true knowledge comes from afar, what is to come, and guides present action accordingly. My name is N. Lemon Matthew. Don't forget my name in the future. Thank you so much. May God bless you all.
Thank you all. Thank you for the active participation. If anyone wants to give any feedback about our webinar, can raise your hand. We will unmute you. Thank you all. Ansha, shall we wind up?
Yes, ma'am. Thank you, ma'am.